welcome to the office. Jasir, welcome to the office.
Hi, nice to meet you, sir.
Where are you coming from?
From Las Vegas.
What's going on? How can I help you?
Well, I've been having an issue with my back since I was like 18 years old.
What happened?
It first started when I fell on my tailbone while I was playing soccer. I was actually playing keeper, and I dove for a ball. I landed on my tailbone.
This is back in LV?
Yes.
All right, you're coming from Las Vegas, right?
Correct, yes.
Okay. So you're goalkeeper back when you were around 18 years old?
Yeah. I actually wasn't a goalkeeper. I was playing goalkeeper that day.
Okay.
Yeah.
Okay.
So,
And what happened?
I just like flew to get the ball, and the guy pushed me backwards, and I fell on my tailbone.
Okay.
And the pain went away for after a week or so, but it started again, and then I went to a chiropractor after that.
Did you get any x-rays done at that time to see if anything was going on?
Yes, the first chiropractor did x-rays.
And what did they find?
I believe it was S1C5 that was injured.
It's nice when patients know their numbers, you know their levels, okay? All right, so they worked on C5 and S1 for you?
Yes.
Okay, and I'm assuming you got a good result at the time?
I mean, for the most part, it started again, after a little bit of time.
Okay, and then after soccer or after 18, high school, all that, still continue playing soccer?
I stopped actually because I couldn't perform like before. So.
Okay. What position did you normally play?
Left back, so
Left
defender.
back, defender. Okay.
Mm-hmm.
All right. Okay. And now fast forward to that was your only injury?
No. I want to say a couple years after that, I got into going into a gym and trying to get healthy and all that for my back specifically. And then I was actually lifting a bar, and I heard a pop when I did a squat.
Okay.
So,
low back?
I can't remember exactly where.
Okay.
Just somewhere in the back.
Something popped.
Yeah.
You hurt.
Yes, and then I couldn't. I literally walked off from the gym, and I was
hunched over.
This, yeah.
Okay. And how long was that? You're hunched over.
It usually lasts. I have it once or twice a year.
So you still get it since then,
Mm-hmm.
and that was a couple of years after. So you were about 20.
About 20 at that time.
Okay. All right. So back, neck. What else?
Back, neck. I feel pretty much just the pain going down my left side all the way down.
So sciatica type?
Yes.
So it's starting in the back, it goes through the glute, down the back of the leg?
That side actually, it feels like starting from the shoulder blade area kind of.
Okay.
Here, and I just feel it down here.
So hold on, it's coming from here?
Yeah.
It's going down?
Yeah.
All the way down this way?
Yeah, sometimes I feel it down.
Interesting, okay. He's already given us some answers. Dr. Gonstead used to say, listen to the patient. They're going to tell you the problem, they're going to tell you how to fix them too. Okay, so, and this started when in the neck?
Neck, I think it was after the pop at the gym.
And that was back in your 20s?
About 20, yeah.
Okay, all right.
Yeah, the first one actually, it hurts more over here. And so when I landed on my tailbone, it hurt over
on the right side.
Yeah, the lower.
Did that shoot down your leg?
No,
Okay.
actually didn't.
Okay, that's a local. Do you still have that?
I still have. The pain is mainly on the hip area now.
How the hell did people live like this for 10 years plus?
Yeah.
It's crazy.
I tried looking for help.
Okay. I'm sorry. But I get it, dude. I've been in car accidents as well, okay? I've been in accidents, and, there are things that can be fixed. There are things that I manage, just like everybody else. Now, are you working right now?
Yes.
Okay, physical?
A
desk job, physical work?
I'm up and I sit down, so just varies. But I move a lot.
You move a lot, you
Yes.
get your movements in.
Yes.
Part of your homework here is walking, right?
Correct.
10,000 steps a day. No gym. Anyway, for these 4 days, you're not gymming it anyway. You get your movement as much as you can. Okay. Okay, so local right glute pain.
Yes.
Shooting pain down the left leg can also start from the neck, going down the back of the shoulder, down the back, down the leg, into the toes.
Yes, correct.
Into all the toes?
No, mainly I want to say these 2 at the end.
The outside
Yeah.
sciatica type
It goes
symptom.
like down here.
And behind the outside ankle.
Right.
Okay, so what he's referring to is traveling down along the back of the fibula, for those of you who want the clinical terms, and it's going behind and around the lateral malleolus, going into the 4th and 5th digit at the end, at the toes. Okay, so that's following a very specific nerve distribution. Let's see what we find. Anything else?
Whenever I'm sitting down a lot, and I feel like this side of the body go like lower than this side, so this one stays a little bit higher, I start like feeling like sleepiness.
So you get tired, you lean to the
If I
left
lean
side.
a lot too.
If you lean a lot, meaning when you're sitting at a computer,
Yes, or driving as well.
how much do you drive every day?
I want to say about an hour or so
Okay.
daily.
Not straight though, broken up throughout. the
Right,
day.
yeah.
Okay. So if you're leaning to the left when you're driving.
Yes.
You're a right-handed driver.
I'm right.
Okay. So right-handed driver, lean, you start to get sleepy.
Yeah, well, it kind of like my body tends to go.
Favors.
Yeah.
It favors the left side.
Correct.
Favors the left. No, favors the right.
The favors, yeah, well, it leans this way.
So you lean to the left.
Yeah.
So you're driving with your right hand. You're leaning down on the left. Does your head go with it, or does your head go the opposite?
No, it goes with it.
Okay. All right. So that's some good information.
Actually, when I'm like trying to go to sleep faster, that's like, just,
Interesting.
yeah, so I'll fall asleep faster that way.
That's interesting.
Mm-hmm.
There's a little sinus right here called the carotid sinus, and it's the extension of the carotid artery. It's part of the carotid artery, and there's a sinus massage where you can massage this area and drop blood pressure by as much as 20 to 30 points. So it does make people tired. So there's a little trick massage therapists do. They'll massage right here, and you get really relaxed and tired and all that. So I'm just wondering if you're like this for a long time, if you're pinching on that carotid sinus, or it could be just nerve pressure. We'll see. We'll figure it out. And what I like to explain is this. This is part of the process. And I'm not saying maybe they were on the right track, dude. Maybe you just didn't give them enough time. I don't know. Okay? This is the idea. I want to explain this to everyone so they understand the process. And you think that once you start, you got to keep going. Gonstead had this saying, find it, accept it where you find it, fix it, leave it alone. So the first thing is we got to find the problem. It could be anywhere. It could be a neck issue causing your back pain. I was that patient. I've had at least 50 cases of sciatica coming from a third cervical. I don't know yet until we examine you. But I want to talk about this relationship of the bone and disc. So we have bone, disc, bone. Then we have the hole, or the IVF, or the intervertebral frame, and this is where the nerve exits. We got 24 bones that move, 23 discs in between. We got 33 pairs of spinal nerves. I've got a buddy in the back over there we'll talk about later. But here's the thing. Let's say trauma. This is all based on trauma. And trauma misaligns the vertebrae. So people think, oh, the bone pinches the nerve. No. And Dr. Gonstead was very clear in explaining this to the profession, to people, to the world. And we're just continuing that information. So when the bone misaligns, it dislodges off the nucleus. The nucleus is like the center of the disc. It's the ball bearing. Okay? Follow me. You've heard this before?
Oh, yeah, a little bit, yeah.
Okay. It dislodges off the nucleus. It's not sitting on the ball bearing. We lose 1 or all 6 degrees of motion. But that movement, okay, the movement starts to take some of the disc, and the disc is what swells, that pinches the nerve. So that's what we're looking for. We're looking for that neuritis or that pinched nerve that's causing the patient's issue, okay, in the Gonstead work. We run a meter on the back. You've seen me do that.
Yes.
We're going to run the meter. The meter is looking for that inflammation. That's part 1.
Okay.
Part 2 is static palpation. We're feeling for the edema. We're feeling for the tenderness. We're motioning it to see which way it's stuck. But ultimately, the x-ray will tell us the way to correct the joint or the problem that we find on you.
Okay.
Does that make sense?
Yes.
Okay. And one last thing. in the SI joints, in the sacroiliac joints in the pelvis. Okay, there's no disc there. But here's what Gonstead came in. He was the first one to come up with this, and I don't think a lot of people know this. Dr. Gonstead was the first to articulate and explain the movement of the pelvis. And before him, it was illegal to touch the pelvis. And he actually articulated, he demonstrated, and he drew. Guys, you need to represent and respect his work, dude. You don't have to do me, but you got to respect his work. Because every chiropractor out there that's manipulating the pelvis is allowed to do it because of Dr. Gonstead and his explanation. So we know this does move. We know it does misalign. So he demonstrated it. When we look at the, and I'm explaining this now, so when we get to the x-ray, things will make sense. Okay? So when we look at the joint, it can miss the way the movement of the pelvis is. Sacroiliac. This is the ilium, PSIS. This is the sacrum. When it goes down, it naturally wants to go out. It's based on the shape of this joint. It's called an auricular surface. It has these little grooves. So it sits in there like a tongue in groove. Okay? And it goes down and out, up and in. Down and out, up and in. And that's how they move. And so what he did is he took the pelvis, he misaligned it on models, and x-rayed it. And then he came up with this analysis of the foundation. Okay, follow me so far?
Yes.
Okay. We're going to go to your x-ray. We're going to take a look at your foundation. We're going to take a look at the whole spine. If you have questions along the way, you ask me.
Okay.
If you're uncomfortable with anything, tell me to stop.
Okay.
Okay? And we go deep or we go home. Fair
That's
enough? Now, what you said and what you're complaining of is mainly the low back and the neck.
Yes.
Right? Okay. So when we look at the overall presentation, first thing I want to look at is let's look at the posture, the overall posture. And if I run a posture line from the base of L5 or the lowest lumbar, and I run it up through the neck, it should go through 7 here and 2 here. And what we already see here is that we have a slight anterior head carriage. Angle measurement, so we go from the base, go up and over, and it's 12.7 degrees. Okay? 12.7. Come on, dude. For every 10 degrees forward of anterior head carriage, it's like an extra 10 pounds on the cervical spine. This is about 120 pounds you're carrying on the neck. So even though the neck is the issue, we're also getting it across the shoulder blades. I'm pretty sure those muscles tighten up, right? Okay. Now, and we'll get back into more of this detail later. Let's go into the foundation and see what we got going on. So when we look at the overall picture of the spine, this is the foundation, this is the spine. And overall, it doesn't look too bad here. We do have some deviation going on. Something, whatever happened here, the main kink is here in the upper back.
Okay.
But even then, I want to be very clear. My business isn't here to try to straighten out people's spine on this x-ray. That's not my business. My business is, do we have a level base and foundation? Find the pressure, and can we help reestablish those side curves? Okay? Straight up. Now, let's go to your foundation and let's get an overall. Let's see what's going on here. And when we look at the foundation, what are some of the things that we see? Do we have a level base foundation? We're slightly off a little bit. This is the crease of the bum here. This is the pubic bone. There's a slight disconnect. We have a sacrum that's tilted down on that right side. Do you see that?
Yes.
Okay. And then we have some uneven weight distribution we can see by the whitening of the rim of the acetabulum or the hip socket. Okay. You can see one side looks a little bit whiter than the other. That term is called enuberation, and that's a process of bone thickening in order of the demand that the body needs. So it just tells us you're putting more weight on one side versus the other. Okay? That's all that means. Let's look at the numbers and see. This is the, all right. Now, this is what we got going on. The good news is you don't have any sacral rotation. Rotation is fine, but you do have that tailbone injury that dropped your sacrum on the right side, just like you said, 5 millimeters. Okay? Now, both sides have been listed, and I believe I may agree with you on that initial tailbone injury playing, so I may agree with that. It's dropped on the right side, but you had 2 injuries, not 1, because 1 injury doesn't cause that to drop and that to go out. So there was 2 specific ones, maybe a third, but 2 for sure. Now, when I look at remember I was just explaining the pelvis, it goes up and down. So typically we said when it goes up, it wants to go in, AS and IN, PI and EX. Your misalignment is AS with EX. That's trauma. That's why I was explaining that part, okay? So we've listed both sides. We have to find it on you to see which pelvis we're actually going to work on. This is not about adjusting both the pelvis, okay, both sides. That case is very rare. I've had probably 2 and maybe 3 in 20 years where I've had to adjust both sides. Okay. All right, clear so far?
Yes.
We got a dropped hip on the right, 4 millimeter drop. I'm okay with that. Anything under 7, adjustments will hold. If we can get some good movement of that tailbone and get it up, we may be able to change some of that for you, okay? But the idea is the pelvis is out and the sacrum is dropped. That's probably why things weren't holding, okay? You with me so far? From there, now I'm gonna go to the full spine. From there, let's draw it this way. Then we have L5 to deal with, okay? So we can't work on the first floor unless the basement is clear. Does that make sense?
Yes.
Have you had you've had S1 adjusted?
Correct.
Okay. We going down here, S4, S5. Down in the basement, okay? As we go up the spine. Looking at this tells me you played hard, okay? The bones are a little bit concave on the edges. They should be squared. You played hard, you played good. You won a few games, I'm sure. Okay. Here's where the interesting part is. T1, T2, T3, you have a T4, actually a T5, maybe a T6 side slip. And what that is, definitely at 5, maybe at 6. A side slip is where you had a lateral trauma. You had a trauma from right to left. And the bone didn't just go back, it shifted laterally. That's what's causing your neck, dude. So when you say you're tilting and falling asleep to that left side, it's coming from the mid-back. And the same area that's causing this tilt is the same area that's part of the digestive process. So I'm sure there's some digestion. We haven't got into that yet, okay? And so there's the digestion issue. 1, 2 is definitely side slip, 3 is side slip, 4, 5, 6 is a iffy. I don't know until I have to look a little bit closer. Does that make sense? So you see it's tilting.
Yeah, I see it.
And then what is the body going to do? It's not going to be like this. It's going to compensate and want to go back the other way. Now when we look at your neck, we actually have a swollen atlas capsule on the right side. The question is that compensating or is that an issue? I don't know until I examine you. Okay? So far so good?
Yes.
Make sense?
Yes.
Okay. Now let's give you all the good news. Mira, there's your issue. So the lateral film or the lateral x-ray tells us which is the problem. The A to P film tells us how to correct it. And if we look here now, we can see a few things. S1, L5 definitely needs to be set. You can see. And the shape of the disc, you see that's a beautiful disc. Those are all good discs. Now what's interesting here is, I'm just pointing out x-ray findings, okay? We'll get to that part actually. Your L5 got some trauma, that's why your back keeps going out. Your back keeps going out because of this L5 and it's compressing and there's a lot of scar tissue in here. That's the first floor, but the reason it's not holding is because you do have the S1, but the S1's not holding because we have a S5 down here, coccyx. So I'm gonna probably be down here on your first adjustment. If I have to do a coccyx, well, let's see what we find. I need to set that maybe once or twice, get it sorted out, and get over here as fast as possible. Okay? That's my plan. Let's continue up. That needs to open up and level off, dude. 5, 4, 3, 2, 1. Over here, because of the instability or whatever's going on here, we're getting calcification in the discs on the anterior portion of the disc. It's trying to stabilize a little bit over here. That could also be nutritional. So we will be talking about the digestion. But here's the cool part. These discs are all good. Level disc, this is a little thinner levels. It's starting right there. You see how that opens up in the back? That's level. That's the thing causing your neck. Let's count. 1, 2, 3, 4, 5, 6. Okay, let's try it this way. 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5. T5. T6 is level. I'm not going to mess with it. So T5 is our culprit. T5, S4, S5, S1, L5, pelvis. That's what I see here. Okay?
Cool.
Questions?
No.
Ready to get started?
Yes.
Let's do it. Let's do it. Go ahead, just here, walk to the corner of the room and back a few times. Let's see how the walk is. You're going to do that about 4 times for me, okay? And this is your normal walk, yeah?
It is.
So you walk a lot on your heels, don't you?
Yes.
You walk back, like your weight distribution is back.
Yes.
Okay. And that's part of what I was showing you on the lateral x-ray. And that could make sense why there's that uneven or the whitening of the rim there. Okay. Is there pain right now?
I feel the kink over here.
Okay. You can't go there. Okay.
Alright.
Let's keep walking. So when you're watching him walk, you can see. So what I want you guys to look at when he's walking is how is the pelvis moving? And overall, he's compensated pretty well to everything going on. Meaning, you can still function, do your thing, you suck up the pain, right?
Yes.
Yeah. And let's keep going, please. And I don't really see a smooth movement through both his SI joints. He has that little tilt to the right, so it goes a little bit down on the right, a little bit down on the left. He kind of walks like this when he walks. Okay. Walk on your toes, please. I see it better that way. Now you can see it goes side to side instead of through, so you're walking this way. Okay, have a seat over here, please. Let's get started. Starting at the base of the neck, let's see what we got. Head down, please. And we're getting third cervical, left side. Interesting, 15 points. Huh. So what's this tat you said? What is
It's the 7 virtues of the Bushido.
What's Bushido?
That's a Japanese thing I saw from The Last Samurai.
Oh. So do you know the 7 virtues?
I know most of them. I actually have them written down on my phone just in case I forget.
All right, guys, let's see who knows the 7 virtues of the Bushido. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. It was like someone who came with the chakras almost. All right, next thing we're getting. Okay, here's what's interesting. So we're getting that third cervical. It looks like it's going to break there, but it doesn't stop there. It keeps going down. It goes to the right, and it breaks in the middle of the back here. That one's not showing up yet. Oh, but it will. We're getting T11, T12, but hold on. That's not breaking, it's flushing out. Now it's showing up. Now I'm getting at the 6th virtue. All right, guys, what's the 6th virtue of the Bushido? Okay, that washes out. That didn't happen either. You got a lot of compensation going on here. I just need you to walk. There it is, down in the low, S5, S4. S4, S5. We got to distinguish between those two. Let's try that again. Virtue number 1. I'm going with that one. That one came out. So we have C3. We do have around the T5, T6 area. And we have around S4, S5. Okay? Those are the 3 spots. Now we're gonna do static palpation. Static palpation. I really wanna know what these are. I'm gonna look them up. That's cool. So check it out, and I guess the tattoo helps us. You can see the swelling. This is all swelling here. Okay, this is swelling. Not too much, but it's there. You can see it starts to get puffy there. Puffy, puffy. And right there it gets more puffy
I
right
feel it
there.
right there.
Right there. You see that? 1, 2, 3, 4, 5, 6, 5, 6, 7, 1, 2, 3, 4. That's 5. 5 more tender, 6 more tender.
5.
5 is more tender and swollen. 6 is a little stiff.
It's a little bit.
Yeah, it's a little stiff, but it's not it. 7. Not too bad, right?
No.
T5, let's check the low back. So, we're looking at the motion of the sacroiliac joints. Feet together, opening and close. This is general motion of the sacroiliac joints to the right side only. As he does the right, left goes with it. It's stuck. Left side only, please. When he does the left, the right's stuck too. They're both stuck. But we're going to start down low. 1, 2, 4. Right. Let's check the motion from S1 so you can feel it. Come back slowly. This is L5. Tender.
Yeah, right there.
Okay. S1.
Yeah, a little bit.
S2.
Up. Yeah.
S3. S4.
S2, I felt it.
And S5.
Yeah.
Right there. Now, L5 is there, I get it. S2 is there, but it's starting down here is what I'm trying to show you.
Okay.
You got it?
Yes.
That's S5. So we have S5, T5. Now let's check the next. Sit back for me, please. I gotta mess up your do just a bit. 7, 6, 5, 4, 3. When I bend to the right, it's fine. When I bend to the left, it's C3. Okay, game plan. Let's take a look. C3, T5, S5. C2, C3 is a PLS. T5, 1, 2, 3, 4, 5. PLS, I can justify that too. And we said we're going to do S5. And the way we're going to do that is, I'm actually going to do that on the side. And it's also wedged on the left. Alright, everything is left-sided, dude. Alright, so S5, T5, and C3. That's where we're going to start today.
Okay.
Okay?
Yes.
You ready?
Ready.
There you go. Bottom leg straight off the edge of the table. So now when I roll you, it should be a lot easier. There we go. Let it roll. A lot easier now, right?
Mm-hmm.
Okay, we'll be on the outside. And I'm going to set up that way. Relax there for me. That's the home run. Come up slowly. Walk it out. One more time. Diferente.
Yeah, I feel better.
Let's go over here face down. T5.
I don't feel a lot of pressure on the right side.
A lot easier.
Yeah.
Right? Go right side down.
Right side.
Sorry, face down. The first time I had that was with Olga. Olga's a ballerina. It's an old video from like 2018 or so. And she had this right hip pain. And she was so in tune with her body, and we were trying to figure out that case. I adjusted her coccyx S5, and her hip pain was gone. It was pretty cool. Slide up, please. T5. T5. A little bit more. There you go. You okay there?
Yep.
Let me get a tiny bit more there. I'm holding that left. Drop the hands. There's the rest. Gotcha. I'm gonna ask you the 7 virtues tomorrow. You better know them. You better memorize them. Walk it out. There you go. How's that left shoulder right now?
Good. Still a little pain, but
A little different.
yeah, it's different for sure.
Walk it off. Okay, come back over here and now let's do that third cervical, C3. And for the third cervical is the hardest bone in the spine to adjust. And I asked that question, and the reason it's the hardest is because it's the smallest contact. So we got to get right in there. Bring that chin back, shoulders back, sit up a little straighter. There you go, chin back. And I got to sneak in right there. Good. There we go. Let that go for me, please. Feet out, straighten them out there. And that's the whole one. Walk it off, please. That's good. Very nice. Deep breathing. Have a seat, please. Let's continue. C3, T5, S5, coccyx. Head down, please. Look up a little bit, right there. Now, one thing you want to avoid is too much extension in your neck after a C3 adjustment, okay? You want to keep your head level or down about 10 degrees.
Okay.
If you go into extension, it will not hold as well. There you go. 5 is clear. 3 is clear. Sit up straight. S5 is clear. Let's recheck on the motion for the low back. Okay, sit up straight. Change some habits along the way. Come back slowly. That's L5. Different?
Yes.
1, 2. Different?
Yeah, 2 still.
2 is hurting still. That's the one I adjusted.
Feels good.
That's the one. Okay. Go left side down. We don't got the luxury of time, do we? Now, there's no rotation of the sacrum. I'm going to bump S2 lightly. Slide forward. Now, he's a bigger guy. He's pretty solid. Straighten out the leg. Slide down a little bit, please. There you go. And there you go. Just a tiny bit, okay? Tiny bit. S1, S2. There we go. Seriously?
Just a tiny bit.
Seriously? Let it roll a little bit. Let it roll. Seriously? That was some Jedi shit. Walk it out. Seriously? Energy. Walk it out one more time and let me recheck it. If that did it, I'm going to trip myself. His walk is different. You do feel the difference,
I
right?
do.
Crazy. Crazy. Have a seat. Let's see. That was gangster. Back slowly. Mira. herniates too. A little different.
Yeah.
A little bit. Feet together. Open and close the knees. Open and close. Right side only. Left side only. Right hip is doing better. Left hip will probably have to work on down the road. Okay, next is buff and polish. This is vibration therapy. This is to break up the old scar tissue, old habits. That's going to be your L5 table, by the way. Yeah.
I've seen that one.
Let's do the shoulders and ears. Good. Shoulders, let me do the work. Let me do the work. Nice. On your back, please, over here. Sound is the board. Okay, so many ways to use the board. You guys see me go pretty dramatic on it. I can even just do it like this. Or I can do this. It's the same thing. Did one hurt more than the other?
Second one did.
Second one hurt a little bit. You felt it more through?
Yes.
Okay, walk it off last time and then do your hands. As you're walking, just here, I'll let you tell us now what's different. Good, bad, doesn't matter, just different.
Definitely feel more straight. I'm not leaning more towards the right. Feel more stabilized.
Is that a little different? Again, different, we adjusted 3 segments, that's what we found. Is that different from what you've had?
Oh yeah, so way different.
What's different? I'm curious, because you know, I say experience the difference. You can't judge unless you've experienced it.
So I was feeling the pain on the left shoulder area, and it's not there anymore really. I mean, it's still like a little bit there, but most of it is gone now.
Okay.
And same thing with the right hip area down here. I don't feel it as much either.
Anything different in the adjustment type
Oh, the type of
for you?
yeah, I mean, it's literally way different like than all the other
What's
adjustments.
What's different? I'm curious.
So like the that table or machine,
Hylo.
yeah, that one was different. I've never gotten that done before.
Okay. Side posture you've had done.
Ankles, I haven't gotten that done.
Okay.
Side postures, no. The going deep in my tailbone area, coccyx, I haven't gotten that done either. So it's quite a bit, yeah.
Different. Squeeze. Relax. Squeeze. Huh. Squeeze. Lunate. Scalp. Not much there. Squeeze. Squeeze. Okay, this is visit number 1. I'll see you twice tomorrow and then on Saturday and we'll go from there, okay?
Okay, sounds
Welcome to
good.
the office.
Thank you.
You're welcome.